As I mentioned at the beginning, my name is Felicitas Zawaira. I'm the Director for Family and Child Health, under which immunization falls in the regional office. I have already tried to welcome you to Rwanda on behalf of the people of Rwanda, and as I said, when the minister comes, she will do the honors. This meeting has been jointly arranged by UNICEF and WHO, and it serves as a forum to update the global immunization community on key issues we are facing in our field. I would like to thank the government of Rwanda for hosting this meeting in this beautiful town called Kigali. Many thanks as well to the steering committee, who can be found on the online program, for their sterling work in coming up with the theme and topics for this year. I would like now to invite the UNICEF representative to Rwanda to give his welcome. Mr. Ted Maly, please come up. Thank you.
Thank you. Government of Rwanda partners, including the Honourable Minister, who will join us very shortly, WHO and UNICEF colleagues, partners, distinguished guests, ladies and gentlemen, a very good morning to all of you. My name is Ted Maly, and I'm the UNICEF representative here in Rwanda. It's a pleasure to be with you today for this important event, the 2018 Global Immunization Meeting, which has been organized, as you mentioned, by UNICEF, WHO, together with all of our EPI partners. And I'd like to take this opportunity to extend a very warm welcome to all of you, especially those of you who have traveled long distances to join us in beautiful Kigali. My deep appreciation also goes to the government of Rwanda for accepting to host this important event through the ministry, and we are very honored for the presence of those esteemed colleagues here today. Allow me to start by congratulating Rwanda for achieving incredible results in immunization. Immunization coverage is being maintained at over 90%, and inequities have been reduced. Maternal and newborn tetanus has been eliminated since 2004. The last case of polio was reported in 1993, and now Rwanda is one of the first countries that expects to reach measles elimination. New vaccines have been introduced, including HPV for young girls, and these achievements have significantly contributed to the reduction of child mortality as well as disability here in the country. However, globally in 2016, it was estimated that 1.5 million children under 5 still die every year from vaccine-preventable diseases. And we still witness children suffering illness, disability, and death from diseases that we have the knowledge and tools to prevent. This meeting happens at a critical time, the final years of the Global Vaccine Action Plan, which runs from 2011 to 2020. And we all need to keep focus on reaching the plan's targets related to improving coverage, addressing inequities, and introducing new vaccines and innovative technologies. It is also an opportunity to reflect on where we stand today, the changing global context, and how we will need to adapt in the post-2020 period. We need to consider how immunization will be positioned in the ongoing efforts to attain the Sustainable Development Goals, the post-polio era, and the move towards universal health care. As all of you very well know, the immunization community is one of the most active partnerships within global public health, evidenced by our collective work with the Global Polio Eradication Initiative, the Measles Rubella Initiative, the Maternal and Neonatal Tetanus Elimination Partnership, and the Gavi Alliance. We have the experience and expertise collectively to take on the challenges of this next decade. I am confident that this three-day meeting will enable us to focus on the key global priorities, and I would like to reaffirm UNICEF's strong commitment to supporting the global immunization agenda. I wish you all a productive next few days and look forward to constructive recommendations from this meeting. I welcome you again, and I hope you have a wonderful stay in the land of 1,000 hills. Thank you.
Thank you so much, Ted, for those remarks and welcome. I'm now going to move to Diana Chang Blanc, who is the acting EPI coordinator at our headquarters in Geneva, to welcome you to the meeting. Over to you, Diana.
Good morning, everybody. Very happy to see you. On behalf of Dr. Princess Nono Simalela, Assistant Director General of WHO's Cluster on Family, Women, Children, and Adolescent Health, who sends her regrets, Permit me to welcome you to this beautiful city of Kigali and this WHO UNICEF Global Immunization Meeting on Navigating Transitions. I'd like to acknowledge and express our gratitude to our UNICEF colleagues and friends for their sisterhood and enduring partnership to help get us to this day. As well, I'd like to appreciate and thank the government of Rwanda for hosting this meeting, where it engages so many EPI family members across the globe. It's like a big wedding. The previous global immunization meeting was in Sitges, Spain in 2015 with 180 participants. Today in Kigali, we are 240 strong. To all the session organizers who have planned for weeks to make their sessions lively and interactive, we're excited and we're looking forward to experiencing what you have in store for us. We know we will learn from what you have to offer, and thank you. So why is the 2018 theme Navigating Transitions? Well, because we must. The steering committee, which must also be thanked for shepherding us to this day, chose this year's theme given the myriad of transitions in our near future. Polio transition, Gavi transitions, transition to the post-2020 agenda, as well as transitioning to newer, more innovative strategies and approaches to reach more with more. As many of you in this room recognize, WHO itself has been navigating leadership changes in the past year, and WHO's Department of Immunization, Vaccines, and Biologicals, as well as the EPI team, will continue to navigate transition over the coming months. Historically, this global meeting has focused on new vaccine introduction, which is the only GVAP indicator among the 6 that we've achieved collectively so far. Perhaps that says something about the power of this global meeting and of this community. Or rather, perhaps it means, without taking our pedal off the metal, driving forward new vaccines, that we must turn our attention elsewhere. We must watch over other parts of EPI, give greater care to places where we still hope for better. Let me divert for a moment and acknowledge the birthday, the 20th birthday, of something essential to EPI. It is the WHO-UNICEF Joint Reporting Forum, which this year is celebrating its 20th anniversary. Imagine, originally in 1998, when WHO-UNICEF launched this, they first collected data on 8 vaccines and focused data mainly on children under 1 year. It was a 2.5-page Word document. 2 decades later, the number of available vaccines has more than tripled, and the JRF is a sophisticated platform that tracks the cases of vaccine-preventable diseases, monitors vaccine supply and pricing, and provides critical information on key immunization indicators. More than 190 member states consistently report data year after year. Without this commitment on the part of member states to dutifully complete and send the JRF to WHO-UNICEF in the first quarter of every year, we would not know that we have met only one of the 6 GVAP goals. The global stage would not know how much progress we've made in the past decade, nor how much more work we must undertake. Without the JRF, we would not be able to speak as forcefully or measurably about what EPI has achieved, how it has evolved. Its 20th anniversary is a true milestone. Today in this room, we have EPI managers, donors, industry, we have CSO representatives and UN agency partners from all levels. It's a truly global meeting with a mix of individuals and a range of diverse experiences. I invite you to take advantage of this unique gathering and challenge yourself to leave Kigali not only with neat souvenirs in your suitcase, but with a new perspective about your role in shaping the future of EPI. To listen, to learn, engage. We'd like you to help set the post-2020 immunization agenda and leave Kigali feeling better informed to navigate the big shifts afoot. In closing, thank you again for taking the time away from your families and your frantic schedules to join us for these next 3 days. I hope you not only contribute to the success of this meeting, but that you fully enjoy yourselves as well.
Thank you very much, Diana. We are here for a reason, I presume. We are all here for a reason. To learn, to impart knowledge, but at the end of the day, there are people who depend on us, the children of the world. So my hope is that we are going to use the time while we are here very, very usefully. So we are going to jump the portion where the minister was supposed to open the meeting, as I have informed you in advance, and we will move on to the content part of the session. And before we start that, I wish to give you 3 challenges, because 3 is usually a number that people remember, 1, 2, and 3. So first of all, I really encourage everyone to take a moment to introduce yourself to the people at your table. I challenge you throughout these 3 days not only to talk to the faces that are familiar to you, people you have come from the same organization, the same home, the same village. Like me, I'm a village girl. But the people that you find, new ones that you are going to meet while you are here, people you have not met, but have a meaningful conversation with them about their work. There is so much collective wisdom in this room. And if we ask each other the right questions, we can learn so much from hearing the new perspective. I know I'm a bit far, but I'm going to try and see if I can spot 3 faces that I haven't met. While I'm doing that, please can you do that at your tables? 3 people you haven't met, introduce yourself to them. Please do. Thank you very much. Thank you very much. I saw some wonderful smiles. We can sit. Thank you very much. Can we go back to our tables, please? Thank you, everybody. Please, can we take our seats once again? I know it's always fantastic to meet old friends, so we don't stop talking. I have seen wonderful smiles, so you have met old friends. So, shall we move on, please? So, back to my challenges. The second challenge that I want to give you is I wish to propose that you attend some sessions that are outside your areas of expertise. We have added some out-of-the-box sessions. I hope you go to the new topics and expose yourself to new ideas and new perspectives. And the last challenge I want to propose, you know, some years back we didn't have mobile phones, but we survived. You know, we actually survived. And I can assure you that the world will not fall apart if you don't look at your mobile phone. So I'm going to propose that during the plenaries at least, and during the sessions, unless you are engaging in surveys, kindly please put your mobile phones away. I will lead by example. Mine is in my handbag. I'm not going to touch it until the session is finished. I find that a successful meeting is one where you look around and see people engaged in the presentations and not on their screens. And where we go home being able to do our work better because of what we learned. I am positive that you did not fly to Kigali to take a look at your computer all the time and to take a look at your phone all the time. So please help us to focus and get our energies in the right place. As Diana mentioned, the meeting and session organizers have worked hard to make this a more interactive meeting than usual. So we really hope you become involved and you speak up. We welcome your thoughts and participation in all the sessions, and we especially welcome new voices. So please don't be shy. There's nothing right or wrong. We are putting our heads together. And when you hear from someone that you want to connect, please do that. Connect with them in person, or you can use your phone app to connect as well. I would like the beautiful face of the child to be projected on the screen, because that tells us why we are here. That's why we are here. Our work is around saving lives. How lucky we are to have such meaningful work. And given the pace and tenor we'll work at, the time to meet this is a real gift. We have been working on many of the issues being discussed over the next 3 days for years. And while some areas have progressed as we heard, others have stagnated. We do have to collectively start thinking and doing things differently in order to make progress. So I'm asking you, who is here going to have a chance, that chance meeting that results in a game changer to increase coverage and equity? Which partners are going to come up with an innovative way to increase the amount of domestic financing to ensure sustainable health and immunization financing? What bright idea will be introduced in a session that will have a dramatic impact on saving those lives? We are going to paste these 3 questions around the room so that as we move in the next 3 days, you keep reminding yourself why we are here. Without further ado, I'm now going to ask Professor Helen Rees to come here. Professor Helen Rees is an old friend, but I'm pleased to introduce her so that she can give us the keynote speech. Professor Rees is Executive Director at the Wits Reproductive Health and HIV Institute of the University of Witwatersrand, where she is also a personal professor in obstetrics and gynecology and is co-director of ALIVE, the African Leadership in Vaccinology Excellence Program. She chairs the South African Health Products Regulatory Authority. She's an honorary professor at the London School of Hygiene and Tropical Medicine and an honorary fellow at Mary Edwards College, Cambridge University. And she chairs the WHO AFRO's RITAG, having previously chaired the SAGE. Professor Rees is one of those rare people who has deep technical knowledge in a wide variety of immunization topics, at the same time as having deep technical knowledge on health topics outside of immunization. With this, she can help those of us working primarily in immunization to make connections to wider trends in global health. We are delighted, Helen, that you have agreed to be with us here today. Over to you. Please give her a round of applause as she comes up.
So, good morning, everybody. And Felicitas, thank you very much for the introduction. When you listen to your bio, it sounds a lot, but what I'm now currently thinking is, how am I going to turn pages, have a laser pointer, and advance the slides at the same time? So let's hope I can get that one done. So I was asked, interestingly, for the plenary of a meeting like this, not to talk about vaccines and not to talk about transition. And you'll be pleased that well, perhaps I shouldn't say that, but I'm not going to talk too much about the SDGs, okay? Because I think we're getting good at those lists. I was asked to look from the outside in and to sort of frame the discussion for the rest of the week, to sort of situate where immunization and vaccines rest in the global world in which we live. So I called it Looking from the Outside In. And I'm going to take us through a whistle-stop tour of some of the things that we need to think about that are really going to influence our field in the near future. So let's start with some good news. These are graphs from the 1950s through to the present day. And on the left, you can see what's happened with total fertility. The advent of modern contraception has made an enormous difference, but so has a focus on women's education. And so has, in some parts of the world, changing legislation and changing commitment to women's status. Related to that, with child spacing, we've seen a drop in child mortality. Obviously, in this room, we also know that a lot of that is also attributed to immunization programs. If we put this together, what have we also seen? This is between 1975 and 2050. You can see that life expectancy of birth has really, really increased. Now, the bottom line there, and would be no surprise to us here, is in the red, is the African region. But even in the African region, in this short period of time, you can see that life expectancy has increased. I'm sorry for the people here, I'm going to point on this side. Just look at this, though, in what happened here. There was a plateauing of that increase. It went down and plateaued, and then went up again. And I think that's probably to do with HIV. Because we saw in many of the worst affected countries that the life expectancy went down dramatically, not by 1 or 2 years, but by 10 years and 15 years, and went up just as quickly with antiretrovirals. In the course of this talk, I'm going to focus a little bit more on HIV as well. But this is something that I think we can be proud of. If the success of vaccines, it's a true global success story. I mean, we beat ourselves up regularly that we're not finding the missing children and that we're not getting to the 90s and the 95% coverage that we should. But this is a success story. This is from the Gates Foundation, and this is what you can see of where we were in 1990, where we got to at 89% in 2016. But you can see that there's a very tight band that if we keep going, we're going to stay in the 90s, which is quite exciting. But I'm going to give you a cautionary at the end about that success, so retain that thought of success. Now, what about the changing context in which we all live? Well, I think some of you will be familiar with these photos. I don't even know if I need to talk you through them. This is obviously the G8, where the threat of a trade war was under discussion. This was on President Putin's birthday, having a celebratory drink with the president of China. And the two of them forming a much stronger linkage as the world rapidly changes, extraordinary changes in the last few years. North Korea is obviously very much on the agenda, but I just wanted to put this up as well, which happened in the last week, and many of you will have realized this, that there was an attack, potential attack, on the President Mnangagwa of Zimbabwe's life, and similarly in Ethiopia. Now, in the region like this, if you have a war, if we have a war in SADC, if we have a breakdown of that peace, it will really affect that region. It will affect our region. So while we're looking at the big picture, the trade wars, we must also think about what's happening in our own local region here. Now, we've also seen the rise of nationalism, and the big graph on the left reflects Europe. And that you can see that a whole lot of important things happened in Europe. There was the financial crisis here in 2008, recessions, and then the refugee crisis in 2015. What you see here listed are the rise of nationalist parties, populist parties in various European countries. This is the National Front in France, and this is most recently the Five Star Movement in Italy. We've also seen the same rise of populism and nationalism with the election of President Trump. We can see that President Putin has enormous approval ratings of 86% as a nationalist president. And in India, Narendra Modi displaced the long-standing incumbents in power on a nationalist ticket. So nationalism is really the flavor of the day. And right at the end, I'm just going to come back to that. But I think what I'm going to try and persuade us all of, I think this is an audience that's probably already persuaded, that it's not the best way to go. So here is the trade war. And the thing about the trade war, it's not only about BMWs and Harley Davidsons for those who follow motorbikes. It's not only about that. Trade wars will affect all of us. It will affect poor countries as a fallout to what's happening in the rich countries. So the trade war, if it really takes off, is really bad news. And it's something that will affect not only countries' economies, but it will also affect the donor framework. With this nationalism, we've also seen these very strong stands on migrants. And in the last weeks, we've seen what happened with Italy and Malta refusing entry of migrants who ended up being diverted to Spain. And we've seen Angela Merkel's coalition party starting to crack because of her very progressive, liberal stance on accepting migrants versus those of her parties. With that, the migrants will still keep coming, and I'm going to just talk a little bit about why that would be. Well, looking at the sort of big picture, what has happened as we go back in time? And here is world population, starting way back in 1750 and going up to 2010. And you can see that really world population here, from about the 1950s, really took off. The OECD countries, the BRICS countries, and then the other poorer countries. And we really are on an upward trajectory. Similarly, urban population in a more equal sense has taken off in all of those three environments, the rich, the BRICS, and the poorer countries. Transportation and people owning cars has taken off. Water use has taken off in a way that is not going to be sustainable. But telecommunications has taken off. This is the number of people, can you see, who now have a contract with a telephone. Hence the request that we all turn off our phones. But telecommunications has taken off, and that's a real opportunity for us. And GDP here has gone up. But just look at this, and I'm going to show you the next slide on GDP, because this is the other thing that's happening. The Gini coefficients, the global inequities in income in countries, is really changing and is getting worse. What we can see here is that in the amount of money that was raised, new money that was raised in the world between 2016 and 17, 82% of it went to 1% of the world's population, and 0% of it went to 50% of the world's population. And that growing inequity is a real threat. Put another way, this is from Forbes magazine. This is what's happened to the wealth of the bottom 50% coming down here. And this is the richest 62 people who've now met the poorest people. This is a very big problem, and it's a big problem at country level. The other thing that we have to think about, and I know in the immunization field in this region we often talk about the bulge, the adolescent bulge that we're getting. And this is often described as a demographic dividend. I hate to say this because I'm sure there are people from the World Bank in the room. So what I'm about to say, please discount or put it in brackets. But a demographic dividend is essentially when you have a cohort, a young cohort, who join the labor force, are economically productive, produce money, and then the second part of that dividend is when they start saving, and so you get a second sort of boost to the economy. And we've seen this obviously in the emerging markets in Asia. This is what we think. And we're here in the African region here. This is what we think in this line here should be about to happen in the African region. But the problem is this: is it a demographic threat? Because if we don't have jobs, that demographic dividend won't mature. So what we will have are large populations of young men and young women who will not have jobs or will have very low paid jobs. And what will that do to the stability of our environment? So let's move on and look at migration. And at the moment, worldwide, 1 in 30 people in the world are migrants of some sort. And why is this? Well, in the last 10 years, conflicts have doubled in the world. They've gone up like this, to now over 100 conflicts worldwide. Conflicts are bad. War is bad. It's an obvious thing to say, but we sometimes seem to take it for granted. Conflicts are really bad for the world, which way you look at them. And we're seeing conflicts and proxy wars being played out. And as we know, Yemen at the moment has got the worst humanitarian crisis in the world. And this is what's described as a proxy war between Saudi Arabia and Iran. And the reds on this map are other areas where proxy wars are being played out, so that you don't bring the war to your own doorstep, but you play it out in other settings. So with that comes the refugees. And at the moment, the largest number of refugees are still coming from Syria, followed by Afghanistan and South Sudan, but all from war-torn regions. And that movement is not going to stop, no matter how many borders and how hard we would try to do it. So what does that look like in terms of number of people who are displaced? Well, it's rising very fast. But if we break it down in this chart, in the blue, these are internally displaced people, and in the purple, these are refugees and asylum seekers. But importantly, about 85% of the world's displaced people are not actually going into Europe. They are in the poor neighboring countries. They are in the developing world. Unlike much of the coverage that would lead us to believe that many people are pouring into the richest countries, it's not the case. I think very worrying is that second note there, that by 2030, 46% of people who are living in extreme poverty will live in these fragile states. At the moment, in 2016, it was only 17%, so that's nearly half of the world's poorest people living in these environments. What else is changing the way that we have to think and the way of the world? And clearly, climate change is something that's on all of our minds and our thinking, because droughts, floods, extreme weather conditions, everyone has now experiencing it. The temperature on an annual basis is definitely going up from, if you can see, from 1850 has gone up, and this is on a decadal average. The temperature of the world is going up. Arctic ice is definitely melting, and sea levels are going up. And what happens with this? Well, with this, we get a phenomena that's described as eco-migration. Desertification, drought, being unable to farm your arable land, salination of areas that previously had fresh water are all forcing people from the land. In addition, climate change not only will make people move, but it's estimated that between 2030 and 2050 that there'll be an additional 250,000 deaths from things such as the changing patterns and spread of malaria, malnutrition, diarrhea, and heat stress. Are we looking at that? Well, we are. This is one example. Many of the agencies here will have a focus on climate change. This is just one example that I selected, and it's from the World Bank Group. This is climate change and health with an action plan, and importantly is this sentence here. The aim of this is to support increased resilience of populations to health impacts of climate change by assisting countries to achieve climate-smart universal health coverage. So people are starting to say, well, we can't fix the climate change, but we have to be able to do something about the populations. Are we back? Yeah. So something that we're all familiar with that relates to all of this movement of people, of the changing environments and so on, is the emergence of pathogens and emergency preparedness. If we look between 1975 and 2017, we've seen a range of pathogens emerge, and in ways that even if we were familiar with them, we hadn't anticipated. First of all, and everyone's familiar, the Ebola virus outbreak of 2014 causing over 11,000 deaths, and now repeated smaller outbreaks, which fortunately the DRC have been contained. Then we have the influenza outbreaks, and we've had 3, the largest of which was in 2009, with over 250,000 deaths worldwide. And we anticipate that we are going to have another pandemic flu sometime, and none of us can say when. And at the moment, as we all know, we have very poor vaccines, hence the call for a universal vaccine to be developed. We've also seen the emergence of new respiratory diseases, though, SARS and MERS, and there's efforts now to develop vaccines for these as well. But the worrying thing about these is that they were new pathogens. MERS had jumped between a zoonotic reservoir into humans. So the worrying thing about these is that these can emerge at any time, and again, we can't predict it. And then Zika, we're familiar with this, but this was about changing in vectors. This was about changing distribution of mosquitoes, which also has gone hand in hand with urbanization. And an outbreak and an epidemic that we forget about too easily is HIV, with now 40 million people living with the disease. It's the biggest epidemic that we've had in the last 100 years. It is an extraordinary outbreak, and as I'm going to show you, one of the concerns is it's not yet under control. But what have we done? Well, in fact, there was an extraordinary response, I think, to the Ebola outbreak in 2014. And one of the things, many of the agencies here have rethought and regrouped, and there's been a total restructuring in our response. WHO has restructured and has a new health emergencies program. And we've seen that with, for example, the recent outbreak in the DRC of Ebola, this has been highly effective in mobilizing resources, human resources, into the field. But we've also evaluated countries and said who's ready in terms of pandemic preparedness. These are joint external evaluations. And again, what you can see is that the areas that are least ready to respond to an outbreak or to identify and respond to an outbreak are those in the poorest areas of the world, and particularly in the African region. So should pandemic flu start in our region, there's a very strong possibility that we will be quite slow to pick it up. And what do we know about these disasters? These two charts here are talking about natural disasters. So these are not outbreaks, these are natural disasters. And on the left, you can see that just in terms of absolute numbers, in the orange compared to the blue on the right-hand side, the effect on households with a natural disaster is much bigger on poor households than it is in the blue on the richer households. On the right, it looks at who loses most assets and income, and this was a study from Bangladesh, in Honduras and Mumbai, and in all cases, the people who lose most are the poor. So let's move on to something that we have started to talk about in terms of immunization, and this is the whole question of urbanization. Now, it's the whole question of urbanization. So this is what's happening in terms of mega cities. Cities are growing, but particularly in emerging markets. And if you look here in Asia and in Africa, in the prediction between 2014 and 2050, these are where we're going to see the biggest growth of cities in the future. This shows you where we are in 2018 with megacities. These are cities of 10 million and larger, primarily in Southeast Asia and Asia, and emerging in Africa. By the time we hit 2030, we're going to see many more of those very large red dots in this region and in Asia. And the problem is that these are not well-designed plans. I work in downtown inner city Johannesburg. About a third of the population are migrants from other African countries. What we have now is what you're seeing everywhere are slums. Slums where the sanitation has broken down and flows into the road, where the litter is not removed, where the rats are there. We have big slums. These are not planned for. Do politicians really engage? Not that much, because very often you're talking about the people moving into cities being poor, and often being migrant. And with this comes pollution. This is a picture from Beijing, but I think what this is from some data from Greenpeace that shows the numbers of deaths per day from air pollution. It's now over 3,000 in 2015, and India has caught up with China in terms of the damage that air pollution is now doing to people's health. And deaths from all forms of pollution, again, what we're seeing again is some of the poorest areas of the world also suffering most from pollution, air pollution and water pollution. And in cities, urban immunization is an area that we think that we should be moving into and thinking much more about. There's an estimated 40% of under-immunized children in urban areas in 2016. But the urban poor are often poorly documented, often because they don't have documentation and because it's difficult to do censuses in these rapidly changing, growing populations. As I said, the political will to engage is sometimes not there, and urban populations are often diverse. And one example here from Kampala is that there are 3 million people in the city in the daytime, but only 1 million at night. So this is going to be a challenge that we haven't even worked out how to document, let alone how to address. So let's move on to global healthcare funding, which is something that I think we're concerned about. And in the transitional talks of the next few days, we'll be talking about it. We're obviously worried about the global polio eradication transition, and we're also worried about Gavi graduating countries, and all of this happening at the same time. And we're also worried because we also know that things like the Global Fund's money are also likely to go down. So it's not only that countries will be grappling with immunization, but they'll be grappling with many of the other issues that they get external donor funding for. And we're worried also because where does the money come from? Where will it come from when that money goes? So let's have a look at development assistance. And these are quite busy slides, and the colors tend to merge. But this is a list of the development assistance agents that are contributing to development at the moment. USAID at the bottom. Here is the Global Fund and Gavi. In green are US NGOs and the Bill and Melinda Gates Foundation. Down here we have WHO and the UN agencies, and up here the World Bank. So a very diverse group of supporting donors. And what's happened in the last, sorry, let me just go back there. What's happened here? What you can see, and this is between 2000 and 2010, and 2010 and 2015, that if the blue is the earlier 10 years, and the next 5 years is in red. So you can see that this is positive growth, but you can see that the growth of donor money went down almost from all countries and all the agencies in the last 5 years, and in this case actually reversed and went into a negative. So donor funding has dropped in the last 5 years for health focus areas. What is donor money being spent on? At the bottom here, this is HIV in the blue, maternal health, newborn health. This tiny wee line here, and I'm going to come back to this, are non-communicable diseases. Very little going in here. Most of it still going into HIV and maternal newborn health care. But look at if you can see from the back, it's not too clear, but look at the shape of HIV funding. It's gone up and it's going down. And if we look 2015 to 2016, this is what's happened with HIV funding. It has gone down. Now, why has it gone down? And one of the reasons was, I was at the big Washington AIDS conference in, can't remember what year it was, about 8 years ago, perhaps a little bit less. And everyone was saying it's the end of AIDS. We're having an AIDS-free generation. We can end AIDS. AIDS is over. AIDS is over. It was premature. But I think once you put a message like that out, you have to be very careful about the consequences. And I think a complacency has set in. I'm taking you back to that picture I showed you about the success of the vaccine field. If we start to be too complacent and start to talk a lot about our successes, there is a risk, and I'll show you some of the competition now, that we could see diminished funding. And look at HIV. HIV, this is 10 million people who are affected, that size of the pie, and you can see here, for sub-Saharan Africa, the worst affected, that the majority of the money comes from development assistance. The minority comes from countries. Although it's gone up, it's still a minority. What will happen if that decrease in funding that we see continues? What could happen to this epidemic? Well, this is where we started recording in this graph in 1990 with HIV. The numbers went up and up in terms of new cases. What happened here was we introduced antiretrovirals. We were able to bring HIV right down to where we are today. If we keep going along this route, we're going to be pretty much in the same place by 2030. If donor funding goes down to these very poor countries, look where we might end up. That is pretty much where we were before we had antiretrovirals. So the case has to be very carefully made before you say that you've succeeded and before we take our foot off any pedal. So let's move to universal health coverage now, which is really what I think we're all excited about, seeing it as something that really could start to fix the health system, because all of us say that vaccines aren't vaccines alone, they are part of the health system, we have to strengthen the health system. Vaccines will only work in the context of a successful health system. So this is universal health coverage financing frontier. This is this is the pooled health spending per capita is what you're spending, and here is the universal health coverage index. So if you are spending quite little but up here and doing quite well, then you're doing very well. I'm going to give you the example of South Africa. We're doing terribly. We're spending enormous amounts of money, but we're way below what we should be getting out of it. And why? Because 80% of our expenditure is spent on 16% of the population in the private sector. So we need universal health coverage. We need to get equity. And the other big threat to universal health coverage and the success of getting equity in financing is out-of-pocket payments. And again, who pays most out-of-pocket payments? Well, this is from 2015 data, low-income countries and low-middle-income countries. In the red, this is out-of-pocket payments. So it's the half of all health expenditures in poorer countries come from people's pockets, and that, as we all know, can ruin households. And can change a successful household quite quickly into an unsuccessful household. Now, in terms of universal health coverage and the package of care, one of the things we're looking at is what are we spending money on, and who is receiving the services, and are we getting to people with essential services? Well, down here you can see that actually with HIV and immunization, with the assistance of international donor money, we have done really well. That means we have given access to people. But look up here. Sanitation, hypertension in particular, and tobacco control. And I'm coming on to the next issue that we need to look at. And I showed you that expenditure on that graph was tiny for non-communicable diseases. So if you want to know what's going to come next, you should read The Economist, because The Economist covers seem to be quite useful for things like this. But The Economist did a whole series of non-communicable diseases, asking if indeed this is the next pandemic. If we look at premature lives lost, although most people dying in developed countries are dying from non-communicable diseases, the number of premature lives lost, once again, are in the poorest countries, or in countries where regulation of things like tobacco haven't been very successfully done. Does it matter to poor countries? Well, in this one, if we put cardiovascular, respiratory, cancers, and diabetes together, over a 15-year period, that's a 7.3 trillion budget. What are the patterns of disease then that we're seeing between these countries, and why should non-communicable diseases, where do they start to kick in? Well, starting with the lowest income countries, the pattern of disease in the red you can still see is largely infectious and maternal newborn health. That's still the case. The only one that's creeping in already is ischemic heart disease. If we go to the lower middle income countries, then you start to see at the top ischemic heart disease and stroke as being the leading causes of death. If you go to the next one in the upper middle income countries, then just a few more. If you go to the next 10 causes of death in upper middle income countries, you're moving strongly onto non-communicable diseases, and by the time you hit the richest countries, it's non-communicable diseases. So a report has just been delivered from WHO called an Independent High-Level Commission on NCDs. And they made some recommendations as they looked at this. Firstly, they say it's massively neglected, and that it is associated with poverty. It's not diseases of the rich as we tend to portray it. It creates inequity within countries, that the poor and the non-poor both experience this as epidemics, that mental health is also an issue, and that it's a very good investment to spend money on both detection and prevention. And they also recommended different and novel approaches for governments in terms of taxation on things like tobacco, sugar, and alcohol, and incentivization of lifestyle. They talked about mental health as a leading cause of disability worldwide, with about 300 million people suffering from depression and about 800,000 suicides every year, with dementia now being in the top 10 causes of death for the more developed countries. But three things that they didn't mention that need to be drawn up, we should think about as we think about the context in which we're working. First of all, the high price of some medicines. These are oncology drugs. Now, oncology drugs, you can see this is just year by year in the US spending on oncology drugs. They're going up enormously. This little graph here shows the amount of investment that the pharmaceutical industry is now putting into oncology drugs because they're highly profitable. But if you look, and this is data from the US and data from Europe, that as the cost of oncology drugs goes up, this line here and that line there represent clinical benefit. Very little clinical benefit for much higher costs. The second thing that wasn't mentioned, wasn't relevant there, but is a major concern and something that the vaccine world has something to offer, is antimicrobial resistance. And it's thought that by 2050, it's going to be one of the largest causes of death, with about 10 million people dying every year. And the third thing that they didn't mention was gender. And gender violence, this is just one graph showing gender violence in ranges of countries, the red spots being in the last year and the blue spots being in a lifetime. Gender violence drives all sorts of things. It drives HIV, it drives non-communicable diseases, it drives neglect of children. Gender violence is pervasive, and unless we address gender, we're not going to move. And so I'm going to leave you with this report here. This was a report that some of you will have seen and some of your organizations might have participated in, called the Global Health 50/50 Report from 2018, where they interviewed about 140 organizations involved in global health, and they asked 7 questions about gender equality. These were the findings. Well, these were the organizations, multilaterals, philanthropic funders, private sector, public-private partnership. And here were the findings. Only 55% actually articulated a policy of gender equality. A further 17 said they do things for women, but didn't talk about gender. But 47 were silent on the question of gender. And only 15 of the 68 private sector and public-private partnerships were committed to gender equality. So finally, putting all of that together for the immunization field, what are the take-home lessons that we have? Well, first of all, we need to think about donor funding priorities because they are undoubtedly changing. And we are going to be in competition with non-communicable diseases, for example. We need to be aware of complacency, as I mentioned about HIV, and the idea that the job is done. We need to explore new funding models, learning from Gavi's experience and looking at what the NCDs are now recommending in terms of innovative taxation. And domestic financing is absolutely essential, and we need to support countries to think how they are going to raise the money for this. National ownership, we always talk about it, but political will, legislation, smart taxation and action is going to be incredibly important. But with that is accountability at all levels, and with that is trying to strengthen civil society, because it's civil society who will hold governments to account. We then need to think about the continuing dialogue on some of the things that we know are already on our table and how we take those forward. We need to think about finding the under-immunized, the gender sensitivity analyses, urbanization, epidemics, migrancy, life cycle, the AMR gap. All of those things are new challenges for us in the future. And integration of services is essential. And with integration of services, we should think creatively about that boom in the use of cell phones and mHealth. And we need to have, I would suggest, a new GVAP. We're thinking about it now. But if we do not have a blueprint into the future, if we don't carry that forward, redo it, rethink it in this context, I think we are going to weaken the field. So I'm going to leave you with 2 quotes from 2 men. One is from John Donne. No man is an island, entire of himself. Every man is a piece of the continent and a part of the main. And that's really in response to what we're seeing with this nationalist thinking. It doesn't work for the field that we're in. And then for the hippies in the audience, from Bob Dylan. Come senators, ministers, come senators, ministers we should put into this verse. Please heed the call, don't stand in the doorway, don't block up the hall, for he that gets hurt will be he who has stalled. There's a battle outside and it's raging. It'll soon shake your windows and rattle your walls, for the times they are a-changing. Thank you very much.
Well done, Helen. I think we can give a more effusive round of applause. Wow, is what I can say. When I went to medical school, we did not talk about politics. We did not talk about governance. But as you head in a tour of the world, governance matters. If we are going to deliver for the children, governance matters. Wars stop us vaccinating children. We need to stop the wars. How effective will be our immunization if we are immunizing malnourished children? Urbanization is upon all of us, and we are missing children in those urban settings. Gender matters. I could go on and on. I think you touched on very critical issues, which I hope in the course of the coming days we will really interrogate. Equity and inequity. Where is that fifth child that we've been missing all along? It's an equity story. Now, the minister is here. I'm honored to invite Dr. Diana Gashumba, who is the Minister of Health for the Republic of Rwanda. She has been Minister of Health since October 2016, and prior to that, she served as the Minister of Gender and Family Promotion. Dr. Gashumba is a pediatrician, so what we've been talking about here is not something up there. It's something she has lived and she continues to live. And she brings 17 years of experience in global maternal, newborn, and child health with a focus, Helen, listen, on gender issues. So we have an advocate among us. Honourable Minister, please come and address us and open the meeting.
Good morning. On behalf of the government of Rwanda, I wish you a very warm welcome to the land of 1,000 hills. We are very delighted to have you here, coming from all over the world, from over 45 different countries, to have this global immunization meeting in Rwanda. And we want to take this opportunity to deeply thank WHO and UNICEF for bringing this forum in our country. This is truly an opportunity to learn from each other on the successes and challenges we face in our immunization programs, given the various transitions, both big and small. Rwanda continues to serve as a model of successful immunization program with the support of many of you, great partners we've had for many years, and we also want to thank you very much for this. Three major factors have contributed to this impressive coverage level. We have now a coverage of DTP3 coverage of 93.5%. That was in 2017. The three factors are the strong political will and government commitment, the role of our community health workers at the community level, the use of mobile technology, and all these with your support, as I mentioned. A strong political commitment from all levels of government, from the central level to the grassroots, is fundamental. As you will recall, in 2016, at the first ever ministerial conference on immunization in Africa, ministers of health and other line ministries launched the Addis Declaration on Immunization. This commitment was echoed by the highest level of government when our heads of state from across Africa endorsed the ADI at the 28th African Union Summit. Rwanda continues to push, basing on the political commitment needed to advance our immunization goals. Our President, His Excellency Paul Kagame, is fully committed and is cognizant of the key role that community health workers are playing by unveiling the 1 Million Community Health Workers campaign in Davos, Switzerland in 2013. Mobile technology directly connects community health workers at the village level to the Central Minister of Health in Rwanda. The government has established a real-time community health information system to support the National Community Health Workers Program that allow community health workers to report basic data to include the number of children to be vaccinated. This technology allows the Minister of Health to also send education message to the community health workers that guides them to reach out to patients and to bring their infant from vaccination up to the remote areas. The three factors have resulted in increased immunization coverage of more than 95% with gender and geographic equity, and the successful introduction of the 6 new vaccines into our routine immunization program and the reduction of vaccine-preventable diseases. For example, neonatal tetanus was eliminated in 2004, and the last case of wild poliovirus was reported in 1993. Rwanda was one of the first countries to introduce pentavalent vaccine in 2002 with Gavi support. And since then, we have introduced pneumococcal, rotavirus, and other vaccines, always with the support from Gavi. As a result of health services integration, 90% of Rwandan infants are immunized at fixed sites, and outreach immunization services have been revitalized to reach the remaining unvaccinated with support from government and Gavi. From 2007 up to date, Rwanda has benefited from Gavi health system strengthening support, which has contributed to overcoming immunization program bottlenecks. Despite our achievement, we have challenges. There are uncontrolled factors such as financial sustainability and movement of the population in the region, like refugees, which could hinder the performance of our program. That said, we are very proud to be innovating in multiple areas around immunization and health. For instance, the expanded program on immunization leadership and management program aims to strengthen national leadership and management of immunization programs in Gavi-supported countries. Zipline, a company that is helping Rwanda to innovate by transporting blood products using technology, is another pillar that will, for sure, improve the welfare of Rwandans. So far, Zipline has delivered over 7,000 units of blood across Rwanda, and we are looking at expanding the work and the collaboration between the government of Rwanda and Zipline through use of drones. I'm sure you will have successful and good interaction during this forum, and I hope you will all take advantage of this opportunity to share gaps, challenges, but also to share good practices among countries. In closing, we should all honor the commitment to improve child survival and development through equitable and integrated access to services as a fundamental human rights issue embodied in the UN Convention on the Right of the Child. I would like to finish my note by once again wishing you a warm welcome to Rwanda, congratulating all the partners supporting the government of Rwanda, and assuring you of our full commitment to push more the agenda to protect our beloved children. Thank you very much.
Thank you very much, Honourable Minister. We are now going to break for 30 minutes for our tea break, and I understand the tea is right outside. Please be here promptly at 10:30 so that we can kickstart our next session. Thank you, and tea break. Bon appétit tout le monde.